Hi guys, and welcome to another episode of the ATP Science/Modern Women's podcast with your hosts, Elisma and Nick. And today we have a really special guest with us, Dr. Shelia Kilbane from Charlotte in North Carolina, who is an integrative pediatrician who runs a clinic called Infinite Health over there and deals with a lot of children's allergies, gut health, that sort of thing, all things child chronic illnesses. So welcome, Shelia. Lovely to have you here today.
Thank you. I am super excited to be here.
Great. Yeah, we are too.
Yeah.
So I guess first question before we really get into it is you were originally a mainstream pediatrician and you moved over to integrative pediatrics. So can you sort of give us a bit of a, rundown of why you chose to go down the alternative path or the integrative path?
Yes, and I'm sure that some of the people listening can identify with this. Is I was in a clinic after I finished my training, and I was doing antibiotics and steroids and antacid medications, and it was the same. I'd meet these kids would be in once a month, and I would give a medication. They would get better for 2 weeks, and then 2 weeks later they would be sick again, and they'd be back in the clinic. I got to know the moms really well. And they would always look at me and say, "Isn't there another way?" And I would be thinking, I don't know. This is how I was trained. And so I started reading and researching. And it was kind of the straw that broke the camel's back for me was prescribing antacid medications to 2-month-old babies. And so I just started reading and studying and reading a whole lot more about nutrition and environmental allergies. And I'm a good listener. So the moms would say, "Shelia, I took dairy out of Johnny's diet and his eczema improved." And then what we also found is that the ear infections improved and the asthma improved and they were calmer and they were sleeping better. So I did this for a while because I thought, surely if this is really this easy, I'm going to say easy, meaning, just shift their nutrition, somebody would have told me about this. But that just wasn't the case. And so I was kind of, undercover or in the closet for a while. And then I did the Integrative Medicine Fellowship with Andrew Weil. He's that guy with the big white beard.
Yes. Yeah, we noticed him on your website. We're like, oh my gosh, Shelia knows him.
Yes. And so he started a fellowship out through the University of Arizona that I did. And it was like, oh, these are my people. So I was with, 65 other physicians who all were having the same experience, is that they were realizing food played such a big role, but we didn't know how to educate people. So in this it was a 2-year fellowship, and we studied all about nutrition and mind-body therapies and supplements and herbs. And it was the best thing ever. It was just so good. And so I never say that's why I love integrative medicine, because it's bringing the best of conventional medicine. Of course, I use my conventional medical foundation, and then we just add the integrative component to it. And so also, for people listening, I know that's very similar to the physicians in Australia and around the world, is that we get trained in the conventional, good, solid conventional training. And then a lot of us realize we have some holes in our training when it comes to nutrition, and then some of the more chronic or recurrent illnesses. And we just have a much bigger toolbox with integrative medicine.
Yeah, that's great. And you're absolutely right. It's very similar in terms of, how unfortunately doctors and pediatricians get trained all over the world. There's hardly anything on diet and nutrition, which is really the foundations of good health. And so, it's always when you see, I don't know if I should say it, but seeing practitioners go from the dark side towards the light is always kind of, I think, a good move. In that we know that this is how we're going to get better, how we're going to get our children better, is by having just more tools in the toolbox to kind of help with a lot of these chronic conditions. And I think that's the thing, right? And I think this is across the board. Mainstream medicine have never really been good at treating chronic illnesses. Great at acute, but not always been that great with chronic illnesses. And that's kind of like where you have to expand a lot of your knowledge and look a little bit beyond that.
And Elizabeth, I want to pick on about something you said about going from the dark side to the light side, because it is very much. It's still, some people are like, "What's that voodoo medicine you're doing, Shelia?" And what's this, and it's sort of a joke, but not always. And but my partners, even when I first started doing this, they then, a year later, 2 years later, they would say, "What are the dose of those probiotics, Sheila? What is this over here?" So people are starting, they're starting to realize it. And you're 100% right with acute illnesses, right? You want to be in a good, solid emergency room. But when you're, when you've got Crohn's disease, ulcerative colitis, it's really good to have that combination of treatments.
Absolutely.
And so I just want to touch on, you've written a book called Healthy Kids, Healthy Mums, a 7-step process that can begin to heal your child's chronic illness from the inside out. So are you able to run us through some of those steps, give us a bit of an idea of how you begin with children?
Yes, absolutely. So the way that I always, I'll tell you the steps and then I'll lay out some of the details. So I really like families to think about their health and plan it the way that they plan out a trip, right? So we never go anywhere without knowing, okay, where are we going? What do we need in our suitcase? How are we going to get there? And so the first thing we do is in the program is we complete an assessment so that we know where your child's health is. And then the beauty of the program is that you do it with the whole family, so that not only the kids improve, but the whole family starts to improve. The second step is identifying inflammatory illnesses. So, and I'll go through these in more detail. The third step is identifying triggers of inflammation. The fourth is decreasing factors that harm gut health. The fifth is about food. And we call it the 5 R's of gut healing using food. The sixth step, it's about supplements. So it's continuing these 5 R's of gut healing using supplements. And step 7 is creating that long-term food and supplement roadmap. And we can go into more detail about, some of the steps given the time that we have. But it's really, most of the families in our practice kind of go, they want to have the plan. They want to know what does this look like over the long term, and how do we make it sustainable?
I love that you say, like, you take a whole family approach. You're not just treating the child. It's like, no, if there's going to be, I guess, steps to improving diet and lifestyle, it's the whole family gets involved. I think that's such a great way of addressing this, because it ends up being like that, right? Because mums can't make one meal for Johnny, another meal for Sarah, and dad wants to eat something else, kind of thing. That puts a lot of stress again on mum. And so it does become that's actually a really good way of kind of like looking at it.
Yes. And Elizabeth, as you know, because you're right, you had to change your son's diet. And so it just snowballs through the rest of the family. And it's that one of my favorite parts is seeing how all the family members change. Like, mom goes off her migraine medicine. Dad is running again because his joints don't hurt anymore. They're able, because the way I look at it is what we want more family time and more of those fun, like right, those good belly laughs over stupid things, over the subtle things of our human condition that are really, I think that's what makes life fun. Yeah. And so if we make it so that our health is more, it's just running, it's in the background and it's running well, so that we can do our lives a whole lot better.
Absolutely.
I think it's great too, because obviously our children learn from us and how, our lifestyles and our diets and things like that. So the fact that the whole family is changing is great. So you're sort of covering everything. So if they want to change the child, but they won't change, then it's not going to work. So I love that it covers the whole family. That's really great. Especially
cutting things out like the dairy and the gluten. I mean, that's very hard to say. Johnny can't have dairy and gluten, but the rest of the family is going to have, cheese and bread and all of that. That becomes, very, very hard. So the whole family ends up having to do it. Yeah.
Yeah, definitely. Yeah, so it'd be great if you go into a little bit more detail about some of those steps, just so we can get a bit more of an idea of, what that looks like for our listeners.
Yeah, absolutely. And so we'll have, you'll have these images that you can show as we talk through these. But the first, we do the assessment, and then what we want to do is we want to identify those triggers of inflammation. So if inflammation is illness, we need to figure out what's driving the inflammation. And so we have 5 triggers of inflammation. And, the first thing we always keep in mind is that we all have our genetics, and it's the way that our genetics interact with the rest of the environment. And so we've got our food, environmental allergies, environmental toxins, infectious diseases, and stress. And they all can contribute equally. And we just, in integrative and functional medicine, we're just very pragmatic about going through each of the steps to figure out what we need to do to address where the triggers are. And then the way that I have people visualize it is like a cup of inflammation. So we all, especially with this pandemic, people are understanding the terminology of inflammation and systemic inflammation. And the people, unfortunately, the people who are suffering the most from the coronavirus are people who have a lot of underlying systemic inflammation, right? So if you have heart disease, diabetes, if you're overweight, and in the pediatric world, it would be the kids who have a lot, uncontrolled eczema, a lot of asthma, chronic runny nose, recurrent infections where they're on an antibiotic fairly regularly. And so we need a little bit of inflammation, right? If we cut our finger, we need to have, we need cells to go to that site to stop the bleeding, and we need that clotting. If you sprain an ankle, we need those white blood cells to go to that tissue of the ankle to start to heal that tissue. And what happens, though, is if we have a ton of inflammation, you sprain your ankle, it's going to blow up even more, even bigger than it normally would. And then it's going to take a really, really long time to decrease. And so if we say, okay, we've got our cup of inflammation, and maybe we've got some environmental allergies, and maybe we have a dairy sensitivity. So we'll say, okay, we can't gut down all the trees and dig up all the grasses. So we're gonna take dairy out of the diet, and we're gonna take out a lot of the processed packaged foods, and we're gonna take the cup from being overflowing to where it's only a fourth or a half full. So that then when you sprain an ankle, or you get exposed to the coronavirus, or your seasonal allergies hit, your cup is maybe going to only go to 3/4 quarter full, half or 3/4 full. You may not even need to use the allergy medicines that you usually use. And then you know where the inflammation is coming from. And then if there's a birthday party or, a holiday, you can maybe have some of that food or some of that dairy, but you're going to be careful not to have other exposures, and you're going to know how to treat it, and you're going to know where the symptoms are coming from. So it's always about education, which is why I love you doing this podcast, because when moms understand this, and dads, it's a huge and powerful tool in their toolbox to really help keep things on that nice, steady roadmap.
I love that you say that, because it's not always, you pretty much describe looking for the root cause there by going through all of those triggers. And it's not always, and it's a cup of inflammation. It's not that dairy is the main thing, but it just adds to that inflammation. And it is just about, minimizing it. And I agree with you, Sheila, like me and Nicole see it a lot in clinic, as you do, that it's very rarely just one thing that's a contributing factor. It's usually a combination of some of those triggers. Some of them may be more than others, but you usually have a few areas that you've got to kind of like work on. But you start with the easier ones, the easier ones first, to try and just dampen that inflammation a bit more.
Yes. And to make it even a little bit more simple is I go through a mini cleanse, and we call it a mini cleanse for kids, but it can be for everybody. And so what we do, and again, I'll send you this visual, but we have it, the first, you can either do something, change one thing over each one day for 7 days, or you could do it for a week. So the first thing is you cut out sugary drinks. So sodas, juices, which are full of sugar. A juice has almost as much sugar as like a cup of juice and a cup of soda. And then the second day, you take out artificial dyes and colors, right? So Skittles, cereals, and you'd be surprised so many of the things that have artificial dyes and colors in them. And then packaged snacks is the third day. And then the fourth, we decrease refined sugar, so donuts and cookies and stuff like that. And then the fifth day, we do processed meats. And then the sixth day, so processed meats are going to be things like hot dogs and
salamis,
deli meat, salamis. Yep. And then the sixth day is processed fats. So that's going to be things like the French fries, the burgers, all of that stuff is made in, it's all fried up in these oils that are very inflammatory fats. And so just by, cutting that stuff out, just doing that for some people is going to make a world of difference. And then on day 7, you celebrate what you're doing, get outside, try to do a little bit less screen time, but go outside and play. But that's the first. And then we go on to dairy and gluten and talk about those other things, because if you're sometimes we lose the forest through the trees and we go, we're having like a sugar cereal that has a bunch of artificial dyes and colors for breakfast. And then we're trying to take gluten out of the diet or dairy out of the diet. And it's not, we have to do first things first.
Yeah. And a lot of those gluten-free foods are often even more processed than the things that do contain gluten. So yeah, I think you're absolutely on the money there. I love the steps that you go through and looking at the big inflammatory. The sugar stuff is hugely inflammatory, and it's very pervasive in our kids' diets, especially the juices, the juice boxes. And I think that's what's so important is it's good for mums and dads to see a lot of the healthy foods that are being marketed as healthy is not really that healthy.
Yes, completely. And that's the thing is we have to add a little bit of common sense back into it and think how, these companies spend millions and millions of dollars on marketing, and they know what to do, right? They know how to do it. So it's not that you're not bad. And it's also, I think, eating well and who has the most out of their diet, it has become kind of this moral badge. Like, well, I'm paleo or I'm gluten-free and dairy-free. And it's not like right for some, I don't eat gluten and dairy because I feel terrible when I eat it. If I could, I'd eat it in a heartbeat because they're so yummy, they're gooey, they're delicious. So it's not about this thing of I'm better than you are because I'm not eating grains and I'm not doing all this stuff. It's just where is the place that your family feels good?
Yeah.
And that's.
Yeah, love that.
Mm-hmm. I love it. I love the education around this because I think a lot of parents feel they have no control when they have a child with a chronic illness or allergies and things like that. And there is only that mainstream medical model of, prescription medication, and they feel like they can't help their child. So to give them some control back, that they can change their diet and they can improve their child's health with what they're doing, I think is really empowering to parents as well to learn that.
Absolutely.
So I think that's great.
So that's in terms of the food, right? So one of the things I'm curious about is like in terms of supplements, because kids, they're not like adults where you can just give them a whole bunch of tablets to take. It's sometimes a bit more challenging. So in terms of supplements, so let's say you treat children with eczema or gut issues or, things where you may have to do some, leaky gut treatment or what have you. Like what is your approach to supplements with kids? And does that change depending on the age?
Yes. Yeah. And so the first thing I want to do is really talk about the quality of the supplements, because I always say to families, if you don't know what you're doing or what you need to use, just don't do anything at all, because you can cause more harm if we don't know what we're doing. And a lot of the, some of the vitamins in the States, the ones that are the number one pediatric recommended, they have artificial dyes and colors in them. It's getting better and it's changing, but all supplements are not created equally, and it's a $1 billion industry. So we always we do one at a time for 5 days before starting the next one. So we always start with a probiotic, and we do a really gentle strain, because what we do is, and we were lucky enough at my clinic to have Elisma visiting us. And so we had lots of time to sit and talk about our processes and how we do things. And I think that's why we instantly fell in love with Elisma when we met her at our conference, because we approach it in a very similar way of really getting the foundations of digestion. And so we use this probiotic, and it's just the one we use. It's a single strain. It's called a Lactobacillus plantarum, and it's soil based. And it really, we don't use it with any fructooligosaccharides or inulin or anything like that in it. Those are the food for the probiotic so that it stays alive. But this one is a very robust species, so we don't need it. So this particular probiotic doesn't cause bloating or gassiness or anything like that. It's really well tolerated. And we do it at the start of breakfast and dinner. And I don't have any randomized controlled trials to show this, but what we think is happening is that it's blunting the inflammatory effect that we get when we eat. We all get inflammation when we eat. And so this decreases that impact. And just the probiotic can really, if your kids have eczema, asthma, constipation, allergies, any of those or recurrent illnesses, and they've been on a lot of antibiotics, this is a perfect place to start. And so we do that. And then the second thing we add in are digestive enzymes. And that's, again, the products that we use are just really good, and they're good potency digestive enzymes. And we do that at the start of breakfast and dinner, right along with that probiotic. And then we'll do an omega-3 fat. Most kids are not eating enough omega-3 fats. So that's what we get from cold water fish like salmon, mackerel, tuna. Probably the most common way families get it is from salmon. Sockeye, wild-caught sockeye salmon will be the cleanest. And you can also, there are, of course, plant-based ways to get it. You just have to eat a lot more of them. Chia seed, flaxseed, hemp seed. Blueberries have a little bit. Walnuts have some. But the powerhouse really are the cold water fish. And so we want to do that because that's going to help make our cell walls. And then the next thing that we add in is either a whole food supplement or a multivitamin mineral. And then after that, we do a vitamin D. And, vitamin D we only need in the winter time, the colder months. And in the summer, we want to stop the vitamin D because we always want to synthesize it naturally. But you don't synthesize vitamin D with sunscreen on. So you have to be really careful because we also don't want to burn. But I think we've gone a little bit overboard on staying out of the sun. And I do think we need to get a little bit of sunshine if, doing it safely.
I love that because that's something that we see a lot is vitamin D deficiencies, and especially in Australia you'd think that we wouldn't have vitamin D deficiencies, but there is like the I guess the protective aspect against the sun has kind of like
There's a fear around being in the sun now, which is obviously we have to be aware of it, but you're right.
And then we see also, like in the States, you're absolutely right. Often in the winter months, that's when the vitamin D kind of like drops off. And vitamin D supplementation is becoming like more and more common. And it's very important because vitamin D plays a huge role in immune regulation, correct?
Yes. So it's right. We have vitamin D acts more like a hormone even than a supplement. And we have a vitamin D receptor on almost every cell of our body. And it plays a role in supporting our immune system and our energy, our metabolism. It helps us to absorb more calcium out of our gut. It's just such an important role in so many different aspects of our health. And it is the further away from the equator we get, the higher our risk of autoimmune conditions. And one of the thoughts is that it may be because of lower amounts of vitamin D.
Yeah.
And that's really good places to start. Again, especially if your kids have asthma, eczema, any of those allergy type illnesses, any, inflammatory bowel disease, even, some of the more serious illnesses, that's another really good place that you want to focus on.
Wonderful.
I'm curious, Shelia, as to what sort of age do you see? So when, obviously a lot of newborns can have severe eczema and things like that. So how would you approach that if you have a newborn child, or do you see many newborn babies with allergies and the skin conditions, and how you would approach that?
Mm-hmm. So we're seeing more and more of the kids who are younger and having a more serious disease process. So, it used to be 10 years ago, we would see a child with eczema and we'd take them off of dairy and do a probiotic and a couple of supplements, and it would go away. And now it's getting more and more complicated. And I think what's happening is the way that we've changed our environment. I think that it's so profoundly impacted our gut and our microbiome, that balance of bacteria in our gut. And it's expressing itself in these babies. And it's the way that so we have an amazing, wonderful pharmacist who works in our office, Deb.
Oh, yes.
And I know, right? I said, I'm going to see Elizabeth tonight. She's like, no. We all had so much fun when Elizabeth was here. 3 times you came, right?
I think so. Yes.
Yeah. So it was the nerds unite. We all could sit and talk about all this stuff. So Deb will always say, and I 100% agree with her, is that we're having babies born to the first generation of moms who grew up in the era of high fructose corn syrup, much heavier use of herbicides on our crops. And I just think that and topicals, right? We're using so many more beauty products now. I read a statistic that women use about 11 beauty products before they leave their house.
Oh, wow.
Makeup, deodorant, lotion, all the stuff we put on our hair. So all the things. So I think that we've changed our gut microbiome, and I think that's why it's getting more serious. So we definitely start wherever we are. And, if I had my druthers, it would be the preconception, and moms would start getting their bodies ready. So if you're listening and you're going to have another baby, or you're getting ready to have your first baby, really start looking at these things and start cleaning up your diet, cleaning up your products, your cleaning products, the beauty products, cleaning products, all that kind of thing. Trying not to use plastics. That's
a big one, isn't it? Like microplastics. I just see it pop up in the news more and more and more in our oceans, in our food supply. There was an article the other day that I'm trying to remember where they found microplastics, and it was in a very commonly eaten food, and they were kind of like shocked to find microplastics in it. I think it was an amount of 3 grams of plastics that people were consuming. Wow. But I can't for the life of me remember what the food was. But it's just becoming, we're becoming more and more aware of all these microplastics, which are endocrine disruptors in our food chain.
Mm. And I'm so glad you highlighted that about the mother's health and what the mother is doing preconception, because I don't think a lot of women do associate what they do, even, a couple of years before they even fall pregnant, how that will affect the baby. So I think that's something that we really need to focus on a lot more. And obviously the mother's gut health, vaginal health, all of that sort of stuff comes into play when you're looking at the birthing process as well. So, and C-section births. I mean, can you give us a little bit of a talk about that, what you see in regards to C-section births and gut health with babies?
Yes. So we know, and the first thing I do want to say is this is never about guilt. If you had a C-section, amen, you were glad that your baby made it, that they were breathing, and that, we have that technology that we can use. And so that don't worry, because we can do a lot to rectify the gut if you didn't do some of these things. What happens when we have a C-section birth is that the baby enters the world through a sterile field, and then the baby gets passed over to the nurse, and the nurse cleans the baby up. And then if the baby was a C-section and then they're bottle fed, we know that they're colonized with a different set of bacteria than babies who are a vaginal delivery and who are breastfed. And what we do, when I was doing primary care and I was seeing the babies right after birth, if they were a C-section, we were starting probiotics immediately, and we would give them to mom if she was breastfeeding, and if not, we would put them in the formula for the babies. You always have, I'm not giving any medical advice, so you have to, talk to your doctor about this. But that is the way that I would do it. And then the minute we saw any little skin irritation or rash coming up, we would pull the babies off of dairy. And I actually got to the point where I didn't even, if the babies could tolerate, some dairy in mom's diet or the dairy formula, we left it as it was. But when they turned a year of age, we just switched them onto water and not onto cow's milk. And but you have to be, I would want that child to be followed by someone who really understands fats, because about 60% of our brains are made up of fats, and our nervous system, right? We have these sheaths around our nerves, and those aren't fully developed until the babies are about 18 months of age. So that's where, in the US, the American Academy of Pediatrics recommends whole fat milk until the babies are 2 years of age. And part of that is for the brain development and the nervous system development. But we have a lot of fats, right? We get fat in meat, we get it in fish, we get it in, if you can tolerate butter, we get it in coconut oil, in avocado, chia seed, flaxseed, hemp seed. So there are a lot of other ways that we can get fats. We just need to make sure that the babies are getting an adequate amount.
Yeah.
So does that make sense? So it's just being diligent if the babies are a C-section, that we're really working on their gut health, and then studies also show that patients, this would be for older patients, but, the people who eat 30 different plant-based foods per week have the most diverse bacteria in their gut. And that diversity is where the magic is.
I love that you say that. Yeah. Because it's the polyphenols, right? So it's the polyphenols we get in all those plant foods. And the highest amounts of the polyphenols are usually in the skins and the shells and the things that we throw away. We peel vegetables and we throw that stuff away. And that's where all those polyphenols sit that that kind of like modifies our gut bacteria. It reduces the more harmful ones and supports the growth of the more beneficial ones and creates that microbial diversity. Yeah.
Yes, exactly. And exactly. It's those dark cherries, and those are the ones that really pack a big punch with our polyphenols.
Yeah, even like grains, like the black rice. Like a lot of people don't even know you can get something like black rice. But anything with a dark coloring, pretty much, rule of thumb is they'll contain quite a lot of polyphenols. So it's just about making different choices and to kind of like get those compounds in.
Definitely. I think that's what we've spoken quite a lot about, that, the ketogenic diets and things like that, and the problems with low diversity in your diet and that sort of thing. So definitely the children. And also, as you said in the beginning, Shelia, the processed foods and things that children are getting, they're not getting that diversity. They're not getting that fresh fruit and vegetables in their diet that's really going to help with their gut. So
because a lot of kids, they're more on like the white food diets, aren't they? It's the potatoes and the bread and how often do you hear mum say, "Oh, I can't get my kid to eat vegetables or meat or anything like that"? So do you see that quite a lot?
Oh, yeah, all the time. And that's why I like doing the mini cleanse first, because we just start engaging the kids. And if we're only making one change at a time, and maybe it takes a week, maybe it takes a month, but you just do that one change. And if we can take out sugary drinks and just add some more water, hydration is key, one of the key components. And then you start adding, the next thing that I do love doing is add a smoothie in the morning, because you get those, you can often get 3 or 4 servings of fruits and vegetables eventually in a smoothie. And, you put a little, either some lettuce or microgreens or spinach or what, and maybe you do 1 leaf of lettuce, and then you do a little bit of a banana and some fruit. You're getting those things in the kids, and they won't even know it. And you make it nice and creamy. And that's where I will suggest collagen powder with some of these kids, because the collagen powder makes it nice and creamy. And then you're getting that we could go into a lot of detail or not, but that collagen powder can help the glyphosate, which is in some of the herbicides that get sprayed on foods. That collagen really helps to displace the harm that glyphosate can do. And, you don't have to do a lot of it for the kiddo, just a small amount. You can do a teaspoon. And that is going to really help to do that great gut repair. And for you moms, it's going to give really great, healthy skin, good hair, good nails. And that's, just in a smoothie. And that way, that you're sending the kids out the door and everybody's had something that's going to pack some of those phytonutrients and the polyphenols and all the things that are to help our gut.
Awesome. Yeah, I love that. We've talked about allergies, so asthma and eczema and stuff like that. But what about behavioral stuff in kids, like ADHD and things like that? Like, what's your take on that?
Yes. So that when I first started shifting the nutrition, and what we found is that, so say it was a child with asthma who also had ADHD. So we would decrease the processed foods, take dairy out of their diet, add a couple of supplements. And the moms would say, not only were they not needing their rescue inhaler any longer, but they were sleeping better. They were calmer. Their teacher may have said something at school that they were able to pay attention better. So that was another thing that I kind of stumbled upon. I understand what happens now, but that's one of the beneficial side effects of improving the diet. And when it comes to dairy and gluten so we know, again, artificial dyes and colors and sugars, we know you can watch a kid, you could give a child a lollipop and you can watch them go berserk. And when it comes to gluten and dairy, they have 3 impacts. This is the way that I've just broken it down to make it simple. So 1, they're inflaming whether you're sensitive to them or not. So it's just the way that the foods are processed, is they cause a little bit of inflammation in most people. And if you look, I don't think Australia is as bad, but if you walk around the US, everybody just looks bloated, and that's part of that. We are a country of wheat and dairy. So it's inflaming. The second thing is that they can have an opiate-like effect. So there's a protein called a casomorphine in the dairy or a gliadomorphine in the gluten. And they get absorbed into the bloodstream and they cross the blood-brain barrier and they bind to our opiate receptors along our brain and our GI tract. And that's where we can get that kind of foggy brain, trouble paying attention, trouble focusing. And in kids on the autism spectrum, this is the part of the aspect of that, is that when you pull the gluten and dairy and they have better eye contact, better articulation, they're calmer, that can be where this is coming from. And then the third impact is from glutamate. So glutamate is an amino acid, but it also acts as an excitatory neurotransmitter. And we have a lot of glutamate in the protein chain of dairy and of gluten. And when we eat them, this glutamate gets broken down. So we have all this free glutamate floating around. And a lot of people will know it as MSG, monosodium glutamate. We kind of know Chinese food has it. We need to stay away from it. And
all those flavorings, right? all the flavorings on chips, which is a big one.
Yes, exactly. And so, and it's in everything. And there we have a list of, or it's not our list, like 60 foods that can have glutamate in them, but you wouldn't know it. And it can even be things like citric acid, protein isolate, yeast extract. So and that's how automatically by cutting the dairy and the gluten out, and then also by decreasing the packaged foods, we're decreasing the glutamate that is in their system. So there's so many benefits to going off of gluten and dairy if you have attention issues, foggy brain, anxiety, trouble sleeping. The list goes on. When I took gluten out of my diet, it was like somebody took a bag off my head. I didn't have energy slumps after I ate. I didn't have a stomach ache after I ate. My GI system started to work better. So I'm somebody who I think has all three of those impacts when I eat gluten and dairy.
Yeah, I had the same thing with mine was dairy. Like dairy was like every time I had dairy, it would be like someone pulled the plug out and my energy would just drain away. So, yeah.
Isn't it? One of the pictures that I'll send you, and you all can show it here, is that I have, it says before beginning the program, and it's one of my patients from years ago, and you can see his, like you look at his before picture, and I always show this when I do talks because so many parents will say, that's my child. And he's got that pale skin. He's got these dark circles under his eyes. He doesn't have a normal, he's kind of a vacant smile. He doesn't have a clear look in his eyes. And then you see the afterward, and he's got the beautiful skin color, that beautiful tone, a really good clear look. He's much more engaged with the outer world. And I also have a picture of him as his senior picture. So he just got a full ride scholarship.
Oh,
but
wow.
You can see when we figure this out early on, and he knows now, if he has so his issue was gluten was more. So often people, it's one can be more than the other. And with him, the gluten actually caused tics. So they originally came to see me because he had tics so bad they pulled a muscle in his neck.
Wow.
So it can be such a wide range of illnesses. It can be snoring, mouth breathing, trouble falling asleep, restless leg syndrome where they're all over the bed at night, bumps on the back of the arms and cheeks, people who get flushing, right? Rosy cheeks and ears, belly pain. It can be constipation or loose stools, bloating, eczema, asthma. So
yeah.
I just think I wanted to make sure that we show that picture because I think picture's worth 1,000 words.
Oh, it is. Yeah, no, we'll that's great. Yeah, we're definitely gonna put that on there. And it's I was going to say something and then I just popped out of my head.
I kept talking.
You just had gluten, didn't you? And you're foggy now.
Yeah, that's just what I was going to say. And so you're right. Like it's such a diverse range of symptoms. And sometimes the answer is so simple. And you have to, like just go stop eating gluten or stop eating dairy. And we have to kind of like consider if there weren't people like you, Shelia, who look at that big picture, how many medications would these kids be put on before they're even 18, right? So you talked about antacids before, Ritalin, probably steroids for the eczema or whatever. And that's before they even reach the age of 18. There's already quite a few medications that potentially kids can be put on if we don't consider all of these other triggers to inflammation and how we can reduce that.
Yes. And Elizabeth, you know how Deb, there's another image that you all can show. And this is, we call it the Pharmaceutical March. And this is because when I met Deb, we both it was like the same experience, but we had different words in a different framework that we saw it in. And the way that she saw it, she worked in, one of the big retail pharmacies here for 17 years. And what she would see is this would be in the adults, but it's the same thing with the kids, is somebody would be put on an antacid medication. So then that buffers your acid and it makes it more, our pancreatic enzymes need that acid in order to be activated. And we need to, that breaks down our proteins, which then make our neurotransmitters. So, and that also breaks down our fats, which make our hormones. So then they would be back, they'd be on the antacid for 6 months, and then they would be back for a sleep medication 6 months later because, right, they're not making all their neurotransmitters. And then they would be back for an ADHD medication because they weren't able to focus, because they weren't, now they can't sleep and they can't pay attention. And so then they're getting it. And it's just the layers of medication that we use to cover up our nutritional lacks, or we're overfed and undernourished.
Absolutely.
And if we're not digesting, we run into lots of problems.
Yeah.
I think that's a question I have, because we were talking about it earlier. So a lot of adults, they are more open to natural medicines, alternative, integrative medicines. But when it comes to their children, they seem to be a little bit more nervous about it and will go more mainstream. Do you see that a lot? And maybe the reasons is that because it's their child and they are so worried and want to get them better straight away. Is it that, or is it more just lack of education? Or what do you see as to the reasons why some parents are a little bit resistant to the alternative style treatments?
I think it's one of the reasons I think that it took me so long to realize this, because you just keep going. If this were really the case, my pediatrician would have told me this. Somebody would have told me this. And it's so hard to wrap your head around the fact that we don't study. At least when I trained, we did not study nutrition. We learned about vitamin C deficiency and scurvy and, a few things like that, but it was not we just didn't study it. So I think that's part of it. And then I think what I have found also is that a lot of my colleagues, they have started to change their diet for themselves, but they don't know how to translate into doing it with their patients. And it was that a lot of the physicians that I trained with in integrative medicine, it was the same way, is that they just couldn't wrap their heads around, how do I do this with my kids? And worry that they're not going to get what they need. And if they don't have dairy, they're going to have, their bones are going to disintegrate. And so there's so much misinformation and fear.
It's the food pyramid, isn't it? Like, we're still being sold the food pyramid. And you're absolutely right. It is that, if my kid doesn't drink milk, where they're going to get their calcium from, despite the fact that calcium in dairy is very poorly absorbed and you get a lot of calcium from vegetables and other sources. But it is that misinformation, like parents are still, the marketing, and unfortunately, like, I don't know what dietitians are being taught at this point in time, but I know not so long ago, it was still all about the food pyramid, recommending cereals as a healthy breakfast. And these are supposed to be people trained in nutrition. And so if average mums and dads, if this is the information they're getting and they trust that information because these people are educated, then why would they question it? And so that's why I think it's important that we, I just love that people like you kind of like, have these programs and books to kind of like do it from a scientific and a medical perspective, in that, no, you can change these things and you're not going to do harm to your child. In fact, you're probably giving them a great start, a better start to life by making some of these changes that would be frowned upon by some of the mainstream, I guess, educators out there, just because they haven't moved on from the food pyramid yet.
Yes. Yeah. And I have a whole chapter on where, sort of how things were laid out and how, it was after World War II in the States, and we had this big surplus because we weren't making ammunition anymore. And so we started to make all this corn, and and then that's where our food pyramids started to say, okay, you need 11 servings of grains a day, 9 to 11 servings of grain. And, you look at that. I mean, we laughed so hard, my editor and I, as we were putting all this together, because we were pulling all the images offline. I would feel so sick if I had 11 servings of grains every day, right? I'd be asleep, first of all.
Yeah. And put on a lot of weight, right? I mean,
you can't. And so there's, for people who want, Harvard, I think, does a really beautiful job of kind of combing through. There's a Dr. Willett at Harvard on the Harvard public health website that you can really go on there, because, and start to weed through some of these things. But they talk about that, and they show their food plate. Now in the US, we use it's a My Plate, and it's got, grains are smaller. And instead of having the milk as the drink, they show water. And it's still in the US government on the My Plate, it's still dairy as the thing that you're supposed to drink. Mm-hmm. And when you go through and look, so I really went back through the marketing history, and I laid out. So we have these marketing campaigns that the dairy industry funded, and they spent millions and millions. Got Milk, and I did a talk for our Charlotte Pediatric Society, and I put all the pictures of all of the sexy stars with their milk mustache. Yes. And then they have the Superman, with all of his muscles, and they say, even if you're not from kryptonite, you can still have bones of kryptonite, and he's got a milk mustache on. And I think the medical profession has succumbed to the dairy advertising, and the dairy funds a lot of in the American Academy of Pediatrics. And when we're looking at some of the nutritional recommendations, it was funded by, some of it is funded by the Dairy Council. Mm. So, we have to follow the money trail, but also follow where health is.
That's right. Because it's not a conspiracy theory if it's right, is it?
Right?
I think it's one of those things that's just sort of rolled and it become Chinese whispers, and suddenly it's the medical profession that are saying about the dairy, but it was just a great marketing campaign from the dairy industry that sort of rolled into, and along the way it's become gospel that it's the medical profession. So it's very interesting to trace it back to where it actually originated.
And I'm glad you have a chapter on that as well in your book. It's like, because it's kind of like demything, I guess, or debunking, I guess, a lot of the so-called facts, which is not really facts. It's that's great that you're kind of educating on that. And you touch on the glyphosates as well. And that is something that I see, especially in the US, like, when we do the testing for environmental toxins and things like that, I've definitely noticed that in the US, glyphosates are a huge issue. I don't see those kinds of levels in clients in Australia, for instance. So there definitely seems to be more use of those kinds of herbicides and pesticides over there, which I think is a big problem.
We like to do it up.
Be the best in the world.
High achievers.
We're going to use it, and we're going to use it well. And they test food. Cheerios, they've tested, and it's got a much higher parts per million than what is recommended, in food that's ingested by the EPA. So, the Environmental Protection Agency. So it's, and as it's water soluble. So even if you're not eating, if you're really doing your best to eat organic and not eat some of these processed packaged foods, we're still getting exposed to it because it's now seeping into our groundwater, and it's then evaporating, and it's raining glyphosate. Yeah,
that's right. So I guess, where do you see? You kind of like have a lot of contacts, obviously. You talk to your colleagues a lot. You can see kind of like what mums are doing, what dads are doing. and all of that. How do you see it going into the future? Do you think there'll be more awareness of this stuff? Do you think people will start taking more control of their health and their diet and things like that? Or do you have more of a pessimistic view in terms of how things are going?
No, I think we're headed in the right direction, and I can see it with this next generation of kids. And so my nieces and nephews are, one set of them they're more of the millennials, and they are all over it. They have one of my nieces just got pregnant. The other one is getting pregnant, and they've been asking me questions from the get-go, and they're eating cleaner. They're not ones to go with the status quo. So I think they're going to force change, and businesses are now being forced to change also. And one of my nieces does a lot. She does marketing, and she said all of the big companies now they're having to do more sustainable campaigns. They're having to do recycling campaigns. They're more nonprofit kind of work. So I think that we've gotten through the part of our world that is sort of the me, take what I need, build up my fortress of walls around myself to protect myself from everything and everyone, to more so of, wow, we've got a limited amount of resources. We have to work together through this. And so I think it's changing. And you can see with the restaurants, I mean, even in the last 7 or 8 years, what you can get from restaurants. I mean, right, we have the best coffee shop across the street from our office that makes the best oatmeal lattes on the planet. You could not find that 5 years ago, at least in Charlotte, maybe out west, out west in the US. But here it's just much, much more prevalent, and a lot more options for healthy foods now.
Excellent. Well,
I actually have one question. We did, when we were looking through some of your things, Sheila, we saw that you spent some time with Patch Adams. Could you tell us a little bit about that? I mean, some of the younger listeners may not know who Patch Adams is.
But they can always watch the movie. There's a movie on Patch Adams. Yes, that's right.
Williams did a movie on him. But what was that like? Because he's an amazing man.
Yes, I love that question. So I was just telling somebody about this yesterday. So Patch Adams there was a movie made about him and Robin Williams played him. So he was a medical student, and he realized how it was just nobody was laughing. Everybody was very serious. And he had somebody who in his life who struggled with mental health illness. And he also realized that we didn't have much to offer in that way. And so he started shifting the whole paradigm and looking at things differently. And he started dressing up like a clown. And so he would go everywhere as in a clown outfit, and started to realize all of the health benefits of laughing. And so when I met him, I went to Russia with him, and it was a group, there were like 20 or 25 of us from all over the world. And everybody we went and did clowning, and I had no idea what I was getting into. One of my medical school professors said, "Sheila, you must go to Russia in the fall. It will change your life." And I was like, and I love this professor, so I would have done anything he told me to do. But I was out of training. I would probably been 2 years out of residency. So we go into orphanages and hospitals, and he would go in and he'd be like, "Come on, Sheila." And we would walk back to the sickest kids. Like one of the kids I remember, he had really bad burns, and he was kind of laying in his bed, and the nurse was yelling at us. She was going, "Yeet." You're like, "No, you can't go there. You can't go there." But Pat just kept walking. And so we go in the room, and he starts to get, and this wasn't a quarantine. It wasn't an unsafe thing. He just was, we were doing it safely, but not overstepping that. So he got the mom laughing, he got the little boy laughing, he got the nurse laughing, and we didn't speak their language. And the boy, he went from laying in bed like this to sitting up, had so much more energy. And we just saw this time and time again. And it was also that of getting everybody around the sick child laughing and in a different mode. And it was such a big lesson on how we have a huge ability to shift the energy around us, and we impact one another so much. And so I started playing with it when I would get back. And if I would often be running late for clinic, and, because here I'm trying to explain all about nutrition in my 10 or 15 minute slot. And so the nurse would come out and she'd say, "Sheila, that mom is really mad that she's been waiting for so long." And I would just go in and I would just smile. And they would never say anything to me, or like, "Where, I've been waiting." And so it's that whole thing of just shifting how we're being. And it was a really powerful experience. And
that's amazing.
Well, there is that saying, what laughter is the best medicine. So there you go.
Yeah, definitely. I think that's amazing. And I think also, I think it's amazing that we have practitioners like you out there, Sheila, because, not painting a brush across all the medical model, but sometimes children are just a number, and I guess they can go in and they sort of get a jab and they're told to leave. And so their experience with that is quite scary. So the fact that you are bringing something a lot more, bringing more human to it, and treating them as little people, not just a number, I think that's amazing and makes their experience a lot better. And, educating the parents, I think it's amazing what you're doing.
Yeah.
Well, thank you. And right back at you. You all are doing incredible education and nutrition, and you've got, great products. So it's all, I think if we all keep doing this together, we will, little by little, we'll keep making those shifts.
Yeah, absolutely.
Yeah.
So Sheila, if people want to get in contact with you, we'll obviously put some links at the bottom of this podcast with links to your book and your website and everything else. But what's the easiest way for people to get a hold of you?
Yeah, my website is just SheilaKilbane.com. And it's just SheilaKilbane.com. And we do my book. So I always think of it in three ways. I have my book, which will be out in September, but it's available now for pre-sale. So that was September 2021. And then we have my online course. And then, my clinic is still taking on new patients. So we have a wonderful team. So there are ways to access this information. And my book it's very detailed. It walks through exactly what we do in the clinic and how to do it step by step with your whole family. So that's why I'm super excited about that, because there just aren't that many people trained, pediatricians trained in integrative medicine. So and parents are ready for it and they're hungry for it. And so I wanted people to have access to this, because we get calls from all over the place of parents wanting this kind of help.
That's amazing. Yeah. Well, great seeing you again, Sheila. It's probably getting a little bit late for you at the moment. But thank you so much for making this time for us.
It's been amazing, great, and I think some of the education that we're putting out there, that you're putting out there, and hopefully our listeners can really learn a lot, and helps them change their focus. So if they have children with allergies and chronic illness and things like that, to look at it in a different way. So thank you for your time. It's been great.
Yeah, thanks, Sheila.
Absolutely. Love seeing you, Elisma, and love meeting you, Nicole.
Likewise.
And I appreciate this.
Thank you.
Thank you so much. Excellent.